Hello, everyone. April is STI Awareness Month, but it's a topic that should be discussed all year long. We'd like to bring you some attention to these infections and give you some information on how you can protect yourself. Some people call them STDs for sexually transmitted diseases. You may run into some old folks who like to call them VD or for venereal disease, but we like to use the term sexually transmitted infection or STI because that's what they are, an infection that can be passed from one sexual partner to another. In the U.S., we have been having increasing rates of STIs. Of the 20 million new STIs each year, half occur in people aged 15 to 24 years old. The most frequent STI is chlamydia, and the age group of 20 to 24-year-olds has the highest amount, with 15 to 19-year-olds coming in second. What's the age of a typical college student? 18 to 25. So these are infections that sexually active college students are at risk for getting, and we do treat students with these infections in the health center. College students are more likely to become infected with an STI because they tend to have more sexual partners and engage in sexual activity while under the influence of drugs and alcohol. And don't think you're safe just because you belong to a particular group. STIs can affect any gender, any race, and any sexual orientation. Now, you may think that you'd be able to tell if your partner has an STI, and that's not always the case. I like to use chlamydia as an example because 7 out of 10 women who have this infection will not have symptoms. The rate is a bit better for men, but still only half of men will have symptoms. Gonorrhea is another STI that many times does not have symptoms. Some STIs like HPV and HIV can take months or years for symptoms to start. Therefore, people may not even be aware that they have the infection and can easily pass it on to their partner. So here's the scary part. When STIs go untreated, they can cause more health issues. The effects can vary depending on which infection you have, but since many people are unaware that they have these infections because they don't have symptoms, it's important to try to prevent STIs. Safer sex is a must. Notice I didn't say safe sex. The only completely safe sex is no sex or abstinence. But if you choose to have sex, there are things you can do to make it safer. First is having one partner at a time. Having multiple partners increases your risk of contracting an STI. Before having sex, you should talk to your partner about your STI history, their STI history, and your drug use. Doing drugs and drinking too much alcohol may lead you to make poor choices. You are less likely to practice safer sex and are less likely to be able to use a condom correctly. Women, douching after sex can actually push germs that cause STIs further up into your vagina, increasing your risk of getting an STI. Sex causes friction, and friction causes tiny tears, making getting an STI easier. So using a lubricant is important. When using a condom, you should use a lubricant that is water or silicone based. Ones that are oil based can degrade the condom. If your partner has any abnormal discharge or sores, you should not have sex with them. If you have any abnormal discharge or sores, you should refrain from having sex and see your healthcare provider. Vaginal and anal sex are considered higher risk of contracting an STI, so engaging in lower risk activities is safer. Using a barrier is essential. There are 3 types. The male condom, which is the most common, a female or internal condom, which can be hard to find and are expensive. The last are dental dams, which is a rectangular piece of latex or polyurethane, which you use if you're going to have skin-to-skin contact, such as placing it over a woman's vulva before having oral sex. They can easily be made by cutting off each end of a male condom, cutting it lengthwise, and then opening it up. Testing is another important part of safer sex. Many times we have students that come in because they have had unprotected sex on Saturday and now it's Monday and they want to be checked for an STI. But as you can see with this chart, many STIs, you have to wait at least a week to be tested. It is recommended to have STI screening, meaning you don't have any known exposure and you don't have any symptoms every 3 to 12 months. Treatment will vary depending on what type of STI you have, but here are some basic guidelines to follow, especially if you have chlamydia or gonorrhea. First, you will be prescribed medication to treat it. You need to take this medication as directed by your healthcare provider. You will need to refrain from having all types of sex for at least 1 week after you finish your treatment. You should be retested in 1 month to make sure that you have been cured of the infection. And you should notify all sexual partners that you have had in the past 6 months that they may have been exposed. If you have herpes, even if you don't have the rash, or if you have HIV, you should notify all potential partners before having sex. Many sexually active college students will contract an STI, but following the safer sex guidelines we just went over can reduce your risk of getting one. So remember to talk, test, and treat. Talk to your sexual partner about your STI history. Get tested at least every 3 months. If you have symptoms of an STI, if you have been told you've been exposed to an STI or test positive, get treatment. If you have any questions or concerns about your sexual health, please call the health center or contact your healthcare provider.